Hi, my name is Carl Bayana, and this is my discharge teaching video for foreign body aspiration. Just to give you an overview before we proceed to the discharge teaching content of this video, foreign body aspiration remains a significant cause of death among children. The obstruction can lead to difficulties in ventilation and oxygenation, thus resulting in significant morbidity and mortality. Before going to the patient's room for your discharge teaching or discharge planning, it is very important that as healthcare providers or nurses, we are equipped with knowledge, information, and resources. If there's any pamphlets from the facility or the hospital that we work at, we can provide them for them to bring it with them when they go home. In reference to the discharge planning sheets that was posted on Moodle, I was able to kind of just like select informations that applies to this case. So the number one thing is I would start off with nutrition. So if there is any specific or special diet instruction from the healthcare provider or the doctor, I need to reiterate to the parent or the mom that they need to follow it as ordered. But usually after bronchoscopy, normal diet can resume. But if the patient or the child has a hard time swallowing the food, they can start with cold drinks or any flavored drinks, ice cream. Then they can proceed to having soft foods such as pudding, yogurt, or some soft eggs. Also, it is very important to maintain good hydration. So fluids is an important thing to be instructed to the parent. Also, in order to prevent any further swallowing in terms of foods, you can instruct the parent to make sure that they slice or cut the food into small pieces, provide information to the parent to avoid giving child a high-risk food such as peanuts, hard candy, or just anything like popcorn that can dislodge easily to the child. And instruct the parent to make sure to give proper, clear instruction to their child that when they're eating, to eat slowly and make sure that they are able to eat their food all the way. And I would move on to mobility, in where it is, as healthcare providers, we need to incorporate the concept of stages of growth and development, in which during preschooler, they are very explorative. They love to explore. They perform imaginative play, and they associate with others when playing. So sometimes they look at others, what they're doing. So it is very important for a parent to make sure to look after their child, to watch them as much as needed, and also to make sure that they're safe. So you have to provide them toys that are recommended for their age, toys that are not easily swallowed, like batteries, marbles, pins, toothpicks, and stuff like that. So you got to make sure that the child doesn't put anything on their mouth, and then give them also clear instruction into what they're not allowed to do. So tell them not to swallow anything while they're playing or running. For mobility as well, post bronchoscopy, which the child in this case just undergone, it is very important to tell the parent that rest is needed. So we have to tell the parent that the child should avoid any strenuous activities or any high demand energy requiring for any physical mobility or activities. Next, we are gonna move on to medications. So medications, if there's any prescribed medications from the doctor, we need to instruct the parent to have the child take it as ordered. So if there's any pain medications for pain in swallowing or any pain in the throat, then tell the parent to follow the instructions by the provider. And also, in this case that we had, cefazolin was ordered. And cefazolin is an antibiotic. I believe that the reason why they're giving it, because sometimes when food or any objects that are swallowed accidentally that can cause a complication for like infections and stuff like that. So they started it, and usually antibiotics, they have a duration of time that you're taking it. So make sure that the parent's aware that they have to take it, the child has to take it in the specific duration as ordered. Next is treatment and procedure. So we have to tell the parent before and after bronchoscopy what are expected, just to reassure that that the parent is informed about the procedure. So usually post bronchoscopy, we have to tell the parent that the child may feel very tired. So 1 to 2 days they feel very tired, so they have to be rested well. So they have to keep away from any strenuous activities. Then the mouth is usually dry for a few hours, so therefore it is important to provide fluids and hydration. And also sore throat may happen the next few days, but if it gets worse, then you have to tell the doctor, or they can also give lozenges if the child can tolerate it. So follow-up treatment is the key part for your child's safety and recovery. So you got to make sure that you go to any appointments or call the doctor if the child is having problems. So we have to tell the parent as well when to call the doctor or when to call 911. So examples to those are if the child passes out or loses consciousness, if the child coughs large amount of bright red blood, more than 1/2 cup of blood, if there's a severe trouble breathing, if there's pain that does not get better with any pain medications, and if there's 38 degrees or more fever, that could be a sign for infection. If there's still a hoarse sound after a few days, then you have to call the doctor as well. And then also if there's a bubble under the skin around the collarbone, which may crackle and pop when they press it. So those are some very important key points that needs to be informed to the parent or the family in order for them to make sure that there's no complications or any other problems that may arise. And also incorporating family-centered care, it is important that we inform the mom and the rest of the family member who are present at that time to make sure to participate and work hand in hand in looking after the child's safety and making sure that there's no objects that can be taken right away by the child and put it into the child's mouth. And yeah, that's it for my discharge video for foreign body swallowing or foreign body aspiration. Thank you.